So here on our beautiful client, we opted to do PDO Fox Eye Lift using Fox Threads. So we created a lift. No, it was painful, but believe me, it's not. She is completely numb. It does look a bit drastic at first, but it does drop by 60% and looks supernatural afterwards. We also tightened under the jawline with threads just to snatch that jawline a little more.
All right, so what are you looking for us to do today?
So I need you to snatch this shit up.
You need me to snatch that shit up?
Yeah.
I got you, girl.
I need a lift.
All right, here we go.
Little, you know. Holy. Holy fuck, this is the coolest thing. I feel like I can't talk though.
Isn't it?
This is a good time. I don't have a neck. I don't ever cry for this. I cried at my nose. That was, oh my God.
Yeah, it really looks good, right?
Oh my God. It took 10 years off me.
It did.
Like it really did.
Yeah.
Oh my God. Seriously, 10 years off.
Oh my God.
Oh wow. So good. Oh wow.
Well, look at your neck.
That's amazing.
Ooh. Who is this?
Oh yeah.
It's so different.
Oh my God. Totally.
Beautiful.
Oh my God. Are you serious? Oh my gosh. Wow. That's so crazy.
See, pop, all that jazz, reverse left. Woohoo!
Wow.
Okay.
There's crazy stuff in my head. Oh my God. Amazing. Looks amazing.
Awesome.
What? Oh, yes. Looks good. Yeah, I'm fine. Thank you very much. Nice.
Today we're talking about PDO threads, fox eye threads, thread lifts, non-surgical facelifts, snatched jawlines, lifted brows, and why this beauty trend is a lot more complicated than it looks online. Because when you first see thread lifts, they look dramatic. The face looks pulled, the brow looks lifted, the jawline looks sharper, the cheeks look higher, and everybody in the room is usually saying, "Oh my God, you look 10 years younger." So I understand why people are curious. It looks like surgery without surgery, a facelift without the facelift, a lifted face without the scars, a snatched look without going under anesthesia. But that is exactly why this conversation matters. Because anytime a procedure is marketed as quick, easy, non-surgical, and low downtime, people start treating it like it is not serious. But threads are still being placed under the skin. They still use barbed material to grab tissue. They can still cause pain, swelling, puckering, infection, lumps, bumps, scarring, and a regret. And unlike filler, if you hate the result, you cannot always just dissolve it and move on. That is the part people need to understand.
We're going to do PDO thread. She's got a little loose skin right here that's bothering her. So I'm just going to elevate into a nicer position. And so we'll take PDO threads and we'll just kind of do some reverse vectors. We'll do some traditional vectors and I'll be able to kind of pick up and move it back. Because when we move it back, she looks a bit more youthful, a little bit more swept, snatched, as we say, as the young people say, and we'll kind of pick up everything.
Doing all right?
Mm-hmm.
All right, good.
Love, girl.
Yeah, when we're working on the side.
That's so good.
Right?
I just felt old. Like, it just.
And this is going to get better and better because it's going to continue to grow that collagen and build that, okay? And we can keep doing like consecutive sessions of that. But this will last you. Let me go grab a few more because your skin was like, all right, I'm just going to pull.
Okay.
And then that brow lift I'm going to do on top of it too.
Okay.
But you're killing it, girl.
It looks so good.
Oh yeah, girl. You were like lifted high.
So it's been almost 4 hours, 3 hours since I got my PDO thread lift. Again, it's been like 4 hours, so it looks like super intense. I went to a doctor here in New York on the northern side. It's very high, so it'll drop in a few days. So it's still crazy right now. It hurt like hell, I'm not gonna lie. I had a lot of emphasis on the lip right here, where I asked him to emphasize because I had Bell's palsy for so I wanted a more symmetrical face. So he lifted it here. It's looking good so far. I'll post my before and afters. As the recovery process goes. It's giving Joan Rivers right now, but so far so good.
So I got face threads for the first time, and I got Botox, and this is the aftermath.
Over here, Dad.
I look beat the fuck up though. She said that she popped like a vessel or something, so it's like blown up.
So today I'm going to my cosmetic surgeon and I booked in for a removal of my threads, but I'm not too sure if that is going to happen because they told me yesterday, they called up and they said that they're going to bring in a clinical practitioner to assess my threads and decide whether or not they think that removal is the best option based on what they see. So I am hoping that they say yes, and I'm hoping that they go ahead with the removal, but I'm not 100% sure if they will agree to. So I'm just going to see what they say, and I guess it's good that I'm having another opinion rather than just the cosmetic surgeon. And I think maybe they're bringing in the clinical practitioner because they're not sure what to do themselves, so they need someone else to tell them what they should do. So yeah, I'm hoping that it all goes well. The reason why I am not doing the Ultraformer session number 2 anymore is because I already did 1 session and I haven't noticed any changes in my threads, and even the anti-inflammatory pills that they gave me didn't work. So I thought the removal is my last option, and I feel like that's the only option that is going to work because it'll just get rid of the threads altogether. I was initially unsure of doing it because I don't want any scarring, but like people have said in the comments before, a little scar is probably going to look a lot better than having these things bulging out of my head. Like they might do the scar, or they might cut through the eyebrow or through my scalp, so it may look a lot better than what it currently does now. But I'll keep you guys updated, and I'll add another video to this video to let you know how it went. Just in case I get them removed and the bumps are gone, I just want to give you guys one last look at these bumps. They've been a part of me for a while now, so I'm going to miss them. Not. If you guys can't tell, I got my threads removed. My face currently looks like I've got 2 golf balls on them, but it's fine. Basically, they removed the threads that they could remove, and they did agree to doing it as well. It was the best option, so we went ahead with it. They removed the threads that were still there. Some of them had already dissolved, so they couldn't remove the dissolved ones, obviously. But yeah, they cleaned it out, they stitched it up, and this is me now. So hopefully, after all the swelling's gone, I'll just have like a minor scar, but I don't think it'll actually stay long term, the scarring, because it was such a small incision that they put in my face.
So thread lifts were something, when I started my practice back in 2004, it got really popular. And people were like, wow, you can take these threads, which basically they're barbed sutures. You know, you could run these barbed sutures on the skin and it would look like you're lifting the neck or the forehead or whatever.
You're reawakening my trauma from when I got threads.
Oh, there you go. And people go, look, these things are amazing because you could run this under, it's not surgery, it's a minor operation, whatever. It's so amazing. And the problem with these threads is that at the time they were permanent, people would literally get a 6 to 12 month result from it. But years later, they'd have these permanent threads sticking out through their skin that they would come to see me and like, oh, we got to clip it off and stuff like that. People realize this doesn't work. And so they abandoned it. And then what happens is a decade goes by, a new generation of doctors come around, and these companies say, oh, I've got this new thing called threads, barbed sutures. They go, really? What's that? Well, we put these little holes in it and then we run on the skin and look how amazing this is. And the doctor's like, I've never seen anything like that. This is revolutionary.
The reason thread lifts became popular is obvious. People want lift. They want the pulled look. They want the fox eye. They want the sharp jawline. They want the lifted cheek. They want that tight ponytail effect without actually having to walk around with a tight ponytail. And in the beginning, the results can look intense. That is what makes it so convincing. You see the immediate lift and think, wait, maybe this actually works. Maybe this is the answer between filler and surgery. Maybe I do not need a facelift. Maybe I do not need more filler. Maybe I can just pull everything back with threads. But that first result is not always the final result. A lot of the dramatic lift you see right away can be swelling, tension, and the face being temporarily pulled. Then the face settles. The swelling goes down. The threads relax. And the result can look much softer than what people thought they were paying for. That does not mean nobody gets a good result. Some people do. But the extreme snatched look people see online is not always what lasts.
Thread lift. Don't even talk to me about it. I think that thread lift is a joke foisted off on people. The idea is putting the thread in from the hairline and threading it under the skin and getting the deep layer of skin and pulling it back up like a marionette. And yeah, if you do that properly and everything works well for a while, it'll lift up the jowls a little bit or the cheeks a little bit and perhaps make you look better. But the reality is, most of the time, that's very, very short-lived. And very often you can see the pull of the threads and it looks like a marionette. And I've taken more of those threads out than I care to talk about. It's not a procedure that plastic surgeons do. There are some cosmetic dermatologists who swear by it. I don't.
Using a fine needle, the doctor inserts thin, dissolvable threads under the skin. These threads have tiny barbs that latch onto the underlying tissue. Once the threads are in place, the doctor gently pulls them upwards, lifting the eyebrows. The barbs anchor into the tissue, holding your skin in its new position. As the threads dissolve over time, they stimulate the collagen production to maintain the lift.
It's time for me to weigh in. Fox Eye Threads, is it worth it? The answer clearly is no, and I'm going to explain why. Number one, look at how thick those things are, and she's so beautiful. Why are you doing this to yourself? These are placed just beneath the skin, not very deep, and look at how thick they are. They're dissolvable, they only last 6 months, and they can cause a robust amount of inflammation and scarring. Second, it goes against all principles of actually lifting the face or the forehead. In order to properly lift the forehead, you have to completely mobilize the scalp all the way down on top of the bone, lift it up, and you can see in this picture there's 2 little bone anchors that you have to put to actually hold the skin up so that it can scar down back in place. So to think that these little threads are going to hold and lift is completely against all principles of plastic surgery. Reason number 3, Jessie, who had to have hers cut out and removed, and she's now dealing with these likely permanent scars. For this to happen to even one person makes it a big no for me. Be careful.
I'm going to try to find the best suspension point I can create. And so she has 4 vectors here. One going this way, one going this way. That's the mid-face area. And then she was bothered by the fact that her lateral brow was coming down, which in turn was causing quite a bit of crow's feet, even when she wasn't smiling. So we went ahead and put 2 threads in this way to really give a little bit of a lateral brow lift and open up the crow's area. And of course, she wanted to have better definition of a jugular digastric or the carotid angle. And you can see how the thread goes. By the way, I'll separate it and show how the thread works at a different suspension point. This one goes here and this one goes here. Okay, so I'm going to remove that corrugation tissue, which is right in front of the ear, and I am going to simply just pinch it up. And you can already see what's amazing, what's great about this is that I can set it up so that she doesn't have to have any lifting up of the sideburn area. We just got done with pulling all the threads to their maximum level. As you can see, pinching that excess skin from the preauricular area or from the ear area has allowed for us to maximally pull the thread without creating any excess corrugation or snagging. The main bulk is still the thread effect, but we had to remove all the excess skin to achieve even a better pull with the thread without the corrugation. We went ahead and we took off the lips of the skin in front of the ear, the preauricular area, and already she's healed up really, really well here. The submental cervical angle here looks much sharper. Is it perfect? No, because we didn't really cut as much of the skin backwards. We just cut a little bit of skin here to really improve upon the jawline and the lower cheek area. But it's much better to see the line that you had, the turkey line here. Okay, so that's much, much, much better. Okay.
All right, guys. So I did my CO2 about 4 weeks ago. So I'm fully healed from that, and now I want to pull up. So I'm good with like cheek filler, I'm good with all that. I don't want to put any more filler in my face. So Stephanie here is going to be actually doing some pulling up with PDO Max threads from all angles, because my main concern are these little great marionette lines and a little bit of the nasolabial. But really I just want pulled up because I want that snatch look.
Yes.
All right, stay tuned.
Smooth threads as well, so stay tuned.
Yes.
And I'm coming.
So this device, this is a cannula, and it's a longer, softer needle. Yes, this is what I place in the skin, but I put this in the skin. Don't worry, you're fully numb. I do numbing injections with lidocaine, and all my clients have said that the numbing is the worst part of the procedure, because when the lidocaine is injected into your skin, it does have a little bit of a burning sensation. However, after we're done with the numbing, the actual thread placement is like easy breezy.
This is where I think the marketing gets tricky. Thread lifts are often framed like a non-surgical facelift. And technically, yes, they can create some lifting. But we have to be careful with that comparison. Because a real facelift is a surgical procedure where deeper tissue is repositioned. Threads are not doing the same thing. They are not releasing and repositioning the face the same way surgery does. They're basically trying to pull the skin and soft tissue with barbed threads. So when people hear non-surgical facelift, they may think they are getting a surgery level result without surgery level recovery. And that is not realistic for most people. A thread lift may give a subtle lift. It may give a temporary improvement. It may help with small tweaks. But if someone has real sagging, loose skin, heavy jowls, or deeper facial aging, threads may not be enough. And that is where people can feel disappointed. Because they thought they were buying a facelift, but what they got was a temporary pull.
Here's the PDO threads on day 6, and you can see that the bruising is subsiding and the radio frequency is helping, but it will probably, I'm told by people who this has happened to before, it might take like 2 to 3 weeks to really like break down the puckering that's going on there. There is a little puckering right here too, if you can see that. Like this one's a little superficial right here, and I'm only noticing it because as the swelling's going down, I can see it more. But overall, I think it's going to be all right. I'm not worried. It seems that people have their opinions, which is totally fine. We're all entitled to that. But I'm not concerned about like, this did not ruin my face. It's going to be okay.
9 of facial threads. So if you guys do not know what facial threading is, it's called a PDO Nova thread. And these are threads that are barbed, and they're basically like a suture, and they go in one direction and then up into the other direction, so that it's holding up here and holding down here to help bring up the face to make it look more taut. So if you did not see me from the beginning, here is a little clip of the day 1, and here we are again at day 9. As you can see, the major swelling and skin puckering has definitely drastically gone down. My jawline, I can still tell, is puffy. I don't know if you guys can see that right down there, but it's still puffy in these areas, okay? And then of course, this area is still sticking out a little bit, same on this side. But again, super happy with the results so far. I have very thick skin, and I also have been losing weight. So even since the procedure, which was 9 days ago, I'm actually down 5 more pounds, okay? And as you lose weight, your skin starts to fall. But I mean, obviously I wish that I could have this tighter, but again, this is not a facelift. This is what they call a homeopathic facelift, but it's not. It's kind of the same effect if you were to put your hair in a very tight ponytail and you're like, oh, I really like the way that looks. It's kind of like that, all right? And we could also accentuate threading with things like Botox and fillers. I myself am thinking that I'm going to do something called a Nefertiti on my chin and neck, so that I could have more defined definition between my jawline and my neck.
It is 3 days after getting my PDO threads and some lip fillers and a little bit of fillers here and here. I do have a little bit of makeup on, so you can't quite see, but you can still kind of see a little bit like the bruising here. There's still a little bit of bruising over here. When I do that, like it hurts, but the pain is a lot better today. Still pretty tender though. Like when I just did that, that still felt not good at all. So I'm still healing, and then sleeping is about the same. I think the first night was worse than, you know, the second night and stuff, but I don't know, not as bad, I guess. Maybe I'm just getting used to it. I'm just kind of like very gently like laying on my pillow. I'm not supposed to like lay on my face, but I cannot sleep unless I'm on my side, I've found over this last couple of days. So
I don't know if any of you have had a PDO thread lift before, but if you have, tell me your experience, because I got one done almost a year ago. And I had an infection after I got it done. So now that it's like starting to dissolve, I'm getting this lump underneath my skin. You can kind of see it. And it's really bumming me out. And I don't know if it's scar tissue. I don't know what it is, but
a lot of people hear temporary and think safe. But temporary does not mean harmless. A bruise can be temporary. Swelling can be temporary. An infection can start from something temporary. A scar can come from something that was supposed to dissolve. And that is why the word temporary can be misleading. PDO threads are often promoted as dissolvable. But dissolvable does not mean nothing can go wrong. The body still has to react to them. The skin still has to heal around them. The threads still have to sit in the right place. And if they are too superficial, people may see the thread, feel the thread, or develop visible bumps and puckering. That is a big deal. Because when something goes wrong on the face, it is not just a small inconvenience. It can affect how you feel every time you look in the mirror. And if the thread is visible, uncomfortable, infected, or sitting wrong, the solution may not be simple. Sometimes you have to wait. Sometimes you need treatment. Sometimes you need removal. And removal can mean cutting into the skin. So the question becomes, was the temporary lift worth the long-term stress?
Thread lifts are good. I like them. They last maybe 6 solid months of really good results. It doesn't do the heavy lifting like a facelift does. So it doesn't really stretch your skin. You basically either go back to where you were or you're a little bit better because you have a little more collagen, which lasts beyond the time that the thread lift itself wears off.
Oh, threads. So before I start, this is an unbiased opinion. I've done threads. I've had threads. Like, I'm trained in threads, but I still fucking hate them. Right, firstly, if you're a little bit squeamish, scroll away. You're not going to like it. So what is threads? To put it into simple terms, threads is essentially barbed wire. So on the end of the thread is barbed wire that can grab onto anything, tissue, fat, whatever it can get its hands on. So your practitioner will place the threads in, twist the thread so it grabs everything, and then lift to get that lifting effect. 90% of practitioners numb people, so all you can feel is the motion, which still feels really funky. Some people don't, which I'm like, why wouldn't you numb people? That's mean. The biggest thing about threads, which everyone in the industry knows, but no one's ever going to tell you, that Instagrammable fox eye look, that really lifted facelift look is bullshit. 3 days later, when you get home, it's dropped, it's gone. Threads, the results are actually really natural. I will admit there are some people where their work is so impressive and it does stick. If you need advice on who, do give me a message because there are some wicked practitioners out there, but for 90% of people, no, it drops. The absolute worst thing about threads is if it goes wrong, if you hate the look, it can't be dissolved. Filler, for example, if you don't like it, 90% of the time, 99% of the time, you can dissolve it. Threads has to be surgically removed, or you just have to wait it out. I'm sure we've all seen, vaping on camera, how rude. I'm sure we've all seen those TikTok videos where girls are left with like, you can see the threads, they have like horns going on. Yeah. If threads aren't placed properly, if they're placed too superficially, you will see the threads. But again, nothing you can do, surgery or just wait it out. Not only that, because the basically the hole that's created for the threads to go in is quite big, it's so prone to infection. I would say like most infections that I've heard of have come from threads. And also because if you're doing something like fox eyes, usually the hole is created in the hairline. So think of how much bacteria is in your hair and like it's impossible to keep it clean. It's just not the one. It's expensive, it's traumatic, and the results aren't quite shit like most of the time.
We literally had to peel these out one by one. When it comes to threads, no. Just finished in the operating room today, and I had a patient who had a bunch of threads put in her face. Hers were mostly submentally. The main reason you don't want to do threads is they don't work. They are not going to lift and snatch you. You have someone that is blindly putting in these plastic barbed sutures. They are not releasing things. They are not appropriately repositioning things. So first of all, they don't work. Secondly, they cause issues. The picture doesn't do this justice. These are like firm plastic things that are in your face. Some were integrated into her platysma, which is this muscle right here. Some were sitting way up in the subcutaneous fat. Some were under the platysma.
Thread lifts sound appealing because they've been marketed as a non-surgical, quick, no downtime lift. But as a facial plastic surgeon, I generally don't recommend them for the face, and here's why. This comes from my own personal experience of performing thread lifts in the past and also having other patients come in after having long-term thread lifts. First, the lift is subtle and modest at best. It looks great initially because of swelling, but the threads don't actually lift the tissue in any meaningful way. The theory behind it is the threads will create scar tissue, which will help lift the skin. They really don't produce enough collagen to have that long-lasting lift. Not only that, the scar tissue that's formed is unpredictable. And they can make any future treatments, whether surgical like a facelift or non-surgical, more complicated because it alters the anatomy. Over the years, I've seen quite a few complications from migration, extrusion. You'll see lumps, bumps, or scars on the skin. I see dimpling, asymmetry. So removing these threads ends up being quite traumatic and can also lead to other side effects and complications. And finally, when you look at the cost versus benefit, it doesn't really add up. It ends up being a lot more expensive because you have to maintain it and repeat it quite often. Ultimately, I just wouldn't offer a procedure that I know wouldn't help in the long run and something that I wouldn't personally do on myself.
The face is too visible to gamble with. That is why procedures like this need to be taken seriously, because people see non-surgical and think it is automatically less risky. But less invasive does not mean no risk. A needle going into the face still matters. A cannula going under the skin still matters. A thread being pulled through tissue still matters. A procedure near the brows, temples, cheeks, jawline, and hairline still matters. There are nerves there. There are blood vessels there. There is delicate tissue there. And there is your actual face. So choosing someone because they had a cute before and after online is not enough. Choosing someone because they are cheaper is not enough. Choosing someone because they promise a dramatic lift is not enough. You need someone who understands anatomy, someone who knows what they are doing, someone who is honest about what threads can and cannot do, someone who is not going to oversell a temporary procedure as a miracle. Because when beauty treatments go wrong, the person selling the dream is not the one who has to walk around with the outcome. You are.
It's like to not even get that good of a result. And it's not reversible. You kind of have to wait for it to wear off, and it will be at least 3 years.
And that's the thing with it, guys. So it's like a literal thread. PDO threads? Is that what
I think so, yeah.
And like they put this cannula in and then they pull it out. It's like a thread, right?
Yeah.
Like an actual thread.
Yeah.
And then apparently it like builds collagen around it, right? Not only does it hurt so bad, I don't really see that big of a difference. Also, Dr. Gavami was saying if you ever in the future want to get a facelift, that's your plan when you're older, he's like, those threads will cause so much scar tissue that it will make a facelift hard in the future.
But it dissolves.
He's saying
Eventually.
if you want, especially if you want bands like this area, he's like, just get an eyebrow lift.
Yeah.
Like if you're going to do that, he calls bands like the fast food of like a facelift.
Yeah, guys, I really don't suggest threads at all.
I did not like
terrible.
it. And dude, this is like so horrifying. This girl made a video too talking about her least favorite procedure. She said threads. And she was like, one day I had like, she's like, I thought it was a whitehead sticking out.
Yo.
My plastic surgeon says don't do threads because they cause scar tissue. Let me enlighten you a little bit. Threads do cause scar tissue, but not in the way you think. It's called microfibrosis. And remember, where are you doing a facelift? You're doing facelift in the SMAS, in the deep plane. Most surgeons do a deep plane facelift. Where you're doing threads is in the sub-Q. Say it with me, sub-Q. So, it's a microfibrosis. It's gone within a year. So you want that collagen production, fibrosis. You want that collagen production, same as you would your Sculptra, same as your Radius, anything that stimulates it emotes collagen. That's what threads are doing also. We're not in the deep plane. We're not in the SMAS. So you don't need to worry, surgeons. It will not bother your facelift. You can have a beautiful facelift and have threads, and it's not a problem.
The fox eye thread trend is one of the clearest examples of beauty culture moving too fast. 1 minute, everyone wanted lifted eyes, pulled brows, a sharp, exotic-looking eye shape, that snatched, outer corner lift. And suddenly people were getting threads placed near the temples and brows to chase a look that was trending online. But this is exactly why trend-based procedures are dangerous. Because trends change. The face does not reset that easily. A makeup trend can be washed off. A hairstyle can grow out. An outfit can be changed, but putting threads under the skin to chase a temporary beauty trend is a different level, especially when the trend is based on a very specific facial shape that not everyone naturally has. Not every face needs a pulled eye. Not every brow needs to be lifted. Not every jawline needs to be snatched. Not every sign of softness needs to be corrected. But social media makes everything feel like something that needs to be upgraded. And that is how people end up doing procedures they may not even want a year later. The biggest question with thread lifts is not just, do they work? The question is, do they work enough for the cost, pain, and risk? Because if the result lasts a short amount of time and you have to keep repeating it, the price adds up. If the result is subtle, but the healing is stressful, the trade-off may not feel worth it. If the lift drops quickly, people may feel like they paid for an illusion. And if complications happen, the cost becomes more than money. Now you are dealing with appointments, swelling, removal, scars, anxiety, and trying to fix the thing that was supposed to make you feel better. That is where beauty culture gets people. It sells the quick result, but it does not always talk about the maintenance, the repeat appointments, the emotional stress, the possibility of being disappointed, the possibility of needing correction. So before getting threads, people really need to ask themselves what they are expecting. Are they expecting a subtle tweak, or are they expecting a facelift? Because those are not the same thing. This is not a black and white conversation. Some people love their threads. Some people like the little lift. Some people feel like it helped their jawline or their brows. Some people go to skilled injectors and get a natural result. And for small tweaks, maybe it makes sense for them, but other people regret it. Some people say it hurt badly. Some people get puckering. Some people get bruising. Some people get lumps. Some people deal with infection. Some people see the threads under the skin. Some people feel like the result was not big enough. Some people have to get them removed. Both experiences can be true. That is why people need more honesty, not just the dramatic before and after, not just the look how snatched she is moment, not just the mirror reaction. People need to see the healing, the drop, the swelling, the bad outcomes, the removals, the long-term opinions, because that is what informed consent looks like. So I think the bigger conversation is this. Thread lifts are being sold as the easier version of a facelift, and I understand the appeal. Nobody wants major surgery if they can avoid it. Nobody wants a long recovery if they can get a quick lift. Nobody wants scars if there is a non-surgical option. Nobody wants to spend facelift money if there is a cheaper alternative. So I get why people are interested, but we have to stop acting like non-surgical means simple. Because threads are still a procedure. They are still going under the skin. They can still hurt. They can still swell. They can still bruise. They can still get infected. They can still leave bumps. They can still create scarring. They can still need to be removed. And the results may still be temporary. That is the cost of pretty. It is not just wanting a lifted face. It is what people are willing to risk to get that lift. It is the pressure to look snatched. The pressure to have a sharp jawline. The pressure to have lifted brows. The pressure to look younger without looking like you did anything. The pressure to avoid aging, sagging, softness, or gravity. And when that pressure gets strong enough, even putting barbed threads under the skin starts to sound normal. That is what worries me. Not that someone chose threads. Not that someone wanted to look better. Not that someone wanted a small lift. But that beauty culture keeps taking procedures and making them sound casual. A little filler. A little Botox. A little thread lift. A little fox eye. A little jawline snatch. A little non-surgical facelift. But little by little, the face becomes something people are constantly editing. And eventually, people stop asking whether they actually need the procedure. They just ask what they can do next. So before anyone gets threads, they need to slow down and ask real questions. What result am I expecting? How long will it actually last? What happens if I hate it? Can it be removed? Will it leave a scar? Could I get lumps or puckering? Could it get infected? Is this provider experienced? Am I doing this because I truly want it? Or because I feel like my face needs to look lifted to be acceptable? Because those questions matter. And I know some people will say, just let people do what they want. And yes, people should be able to make choices about their own face, but those choices should be informed, not pressured, not rushed, not based on a filtered trend, not based on one dramatic before and after, not based on the idea that every natural sign of aging needs to be pulled back into place. Because aging is not a flaw. Softness is not a flaw. A natural brow is not a flaw. A normal jawline is not a flaw. A face that moves and changes over time is not a flaw. So I want to know what you think. Are thread lifts a good non-surgical option for small tweaks? Or are they being oversold as a quick facelift when the results may not be worth the risk? Because, from what we are seeing, thread lifts might look impressive at first, but the real question is what happens after the face settles?